here today. As Tim said, I work for Kent and Medway CCG. I've got a set of slides that I'm going to run through in 10 minutes flat. And so I will do this at pace, but the slides are for you to have and to use and to reflect on afterwards. So if we could move on to the next slide. So Jo talked really eloquently, as she always does, with regard to what we know nationally and what research is showing. I'm able to give some information today around what we've seen in Kent and Medway, particularly around COVID. So the first few slides are going to focus on that. This slide, quite a few graphs. This slide shows us that we have had an impact in terms of the number of referrals coming into services generally. So the top graph demonstrates what we see in the NELFT services, both across Kent and Medway. And the bottom graph is an example of another service, which is our Kent Community Health Foundation Trust emotional wellbeing service that operates in Kent, which is rather large. The graphs show, where you see the graphs with the red dots, that's statistically significant. So it's a statistical processing chart, and it shows that at certain times during lockdown, we saw real statistical significance in the number of referrals coming in. So, for example, the NELFT, we would expect there to be about 1,500 referrals just over a month in normal times. But actually, during COVID, just after lockdown, at 2 points, we saw that reach nearly 3,000. That's what we would consider a double. So these graphs show us that actually we see the peaks and troughs directly related to the school holidays, where we see referrals drop, and then when children come back into school, we see referrals really, really peak, with school holidays and lockdowns. If we could move on to the next slide. This is one of the ways in which we understand the self-harm profile across Kent and Medway, and this is self-harm admissions, so children that are taken into hospital and treated in terms of self-harm. And we can also see that at certain points during COVID, the highest peak there would be May and June. We saw across Kent and Medway statistical significance in the number of children not only presenting but to hospital. So we see that not only are referrals increasing coming into services, but certain pathway peaks. And I'll come in a minute and show you some information with regard to the crisis pathway as well. Next slide, please. So to try to explain what we have done, I suppose, over the last year, we being health, local authorities, voluntary sector, providers and schools, with regard to the response to the demands, and particularly the first demands we saw at the first part of COVID really were around that increase in complexity and acuity and increase in just general referral volume. This slide gives a very brief overview of what had happened. There was a lot of significant and far-reaching work done at pace, a lot of focus around self-harm, expansion of services that are already operating within the system, coordination of services, so that where we saw overwhelming referrals into our main services such as NELFT, we were asking other commission services to take additional capacity to try to release some of the pressure. We also, during this time, commissioned specialist bereavement service to support children and young people, and we expanded a series of services up to the age of 25 and across geographies. So prior to COVID, there were quite a few services that were running that may have operated in Kent but not in Medway, or they may have operated in Medway up to the age of 25 but not so in Kent. We looked really rapidly to expand as much as we possibly could, as quickly as we could. Most recently, we've had a significant focus on our crisis and complex pathways, and the next slide will illustrate a little bit around the demand that we saw. It's probably quite a busy slide. towards the beginning of June this year, what we saw was a number of children waiting for Tier 4 inpatient beds. That and for them to have nowhere to go, there's a national deficit with regard to the number of beds available for children who need that type of care. The numbers across Kent and Medway were significantly high, and the level of complexity and acuity was massive. Higher than in other areas across the southeast. And in June, there was a system response mounted. So all partners came together across the system to see how we could support children and young people who were on the crisis pathway to receive support earlier, but also to coordinate services better. A lot of investment to the crisis pathway recently, where we'll see increased workforce in acute paediatric wards. We'll see increased workforce in A&Es and in the NELFT crisis team, as well as in some of the Kent and Medway Adolescent Hospital. I'd be happy to give more information about this slide. There was a huge amount of work and report that we can possibly circulate in terms of learning around the crisis pathway. But move to the next slide. We are with a significant challenges in the system. We really were working from a deficit model in terms of children's mental health prior to COVID, where about 45% of children across Kent and Medway who had a mental health need seen for their mental health need, according to national statistics. And we were doing very well in that compared to our regional colleagues and nationally, but still 45% was never good enough. As Dr. Nee said earlier on, you know, COVID has exacerbated the problems that were already there, and our colleagues in NHS England are predicting that we're going to see a surge in referrals this year that could be anything around 40% increase in the referrals that we're used to. And we have some very particular challenges around that. The complexity and acuity of children and families appear to possibly be waiting longer before accessing help. And when they do access help, their needs are significant and quite often need a multidisciplinary approach. We do have an issue with regard to our workforce. There is a lot of money coming down through spending reviews and through national programmes, but actually our issues really are around the workforce availability, their capacity to respond, but also the general workforce resilience. All of our sectors have been under a significant amount of pressure during COVID to respond quickly and rapidly to the changing needs of our children and families across Kent and Medway, and that's seen in all sectors. Our workforce are tired, and we do have concerns about the resilience of within the system and capacity to cope. So there's a lot of conversation at the moment where in the conversations that I have with teachers and GP sector and partners around the increased conversation that children and young people appear to have around suicide and suicide ideation. And there's a real sense that the wider system doesn't quite know how to manage those conversations. And it's something that we are looking at in order to try to make the system a bit more resilient, as well as to put in services in that can support that. Can we move to the next slide? I think I've only got a couple. For those of you who may have been at the conference a couple of years ago, I introduced the local transformation plan. It's a plan that the CCG has to have published every year and have done since 2015. Last year, we were given, we were asked not to publish because we were in the middle of COVID. This plan is now online. It was published on the 30th of September. It's available on the Kent and Medway Clinical Commissioning Group website. And it is the plan that describes how we, as a system, meeting the needs of children and young people in terms of their emotional well-being and mental health. There's very specific information in there about how we're adopting the Thrive approach, particularly in terms of a focus on a system approach to Thrive, as well as an approach to inequalities. But it also talks quite explicitly about prevalence and need, and what we're going to do with regard to the long-term plan ambitions that are particularly around things such as young adults, 16 to 25s, eating disorders crisis, schools, and how we increase access. I really commend the document to you. I think if you have it in your back pocket or are aware of it, it may help to give contextual information about how we are trying to address this as a whole system approach, in terms of increasing resilience, early intervention and prevention, all the way up to crisis and complexity. My final slide, and I think I may have done it in 10 minutes, is just an example of some of the services that are out there that are in addition to services such as Shout. The services that are out there for children, young people, or places in which you can find more information. So there's the Mental Wellbeing Information Hub, which is a new website, information website for children and adults' mental health across Kent and Medway. But we also have the really well-established Kent Resilience Hub, where there's loads of resources and support that's out there. But in addition, a number of services as well, from primary to secondary, some services focusing on our LGBT plus population, as well as bereavement services, self-harm, counselling and mental health. So that's just an example of the services that are out there for children and young people. I'll stop there because I know that you've got a really packed agenda, but I'd be happy to have a conversation with anyone at any point.